International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Hi, I'm Ross Koppel. I teach sociology at the University of Pennsylvania, where I'm also affiliate faculty on the School of Medicine and a senior fellow at the Leonard Institute for Healthcare Economics. I'm summarizing my editorial, which was somewhat humorously entitled, "Two Wrongs Don't Make a Right: Flaws in alternatives to fee-for-service payment plans do not mean fee-for-service is a good solution to rising prices." I'm responding to an even more humorously article by Professor Ikegami entitled "Fee-for-Service Payment, an Evil Practice That Must Be Stamped Out." Now, Professor Ikegami provides a careful and very wide-ranging critique of the alternatives to fee-for-service, but excellent arguments against the several alternatives do not necessarily make a good defense for fee-for-service. Also, I think you'll find that several of Professor Ikegami's critiques based on an analysis of the U.S. are not exactly accurate. And then there are some also other weaknesses that we'll discuss. So Professor Ikegami starts with an excellent summary of the problems with fee-for-service. He says that cost escalations, however, are associated with each player trying to gain at the expense of the other, and that prices are set by private insurance companies. Let's look at each of those. It's true that each discipline is trying to benefit at the expense of the other, but it's not a zero-sum game, and the prices continue to increase across the board. The second point, that private insurance companies act to bring up prices, is the exact opposite of the reality. Private insurance companies act to bring down prices because they want to pay as little as possible. Also, the majority of the areas that are to be covered by the private insurance companies are in fact determined by agencies of the U.S. federal government, Medicare, Medicaid primarily, but also the USA pays for the Defense Department medical expenses. It pays for the VA, the Indian Health Service, and others. It also underwrites much of the research in pharmaceuticals, and it underwrites a lot of the teaching hospital costs. Now let's turn to his recommendations for improving fee-for-service. Here I think his recommendations have generally been tried and unfortunately generally failed. He says fee-for-service would improve if the doctors could arrive at a mutually arranged set of costs and prices and specifications. That's been tried repeatedly in the U.S., and it's still a mess, exactly as Professor Ikegami says. It's a conflict zone. I'm reminded that there's a Lutheran minister and sociologist named Peter Berger who once suggested that if cannibals and anti-vivisectionists were placed in a room together for a long enough period, they would probably arrive at a compromise, such as eating your own relatives is a bad idea. Well, we've had doctors and others in that room negotiating for a compromise, and we're nowhere close to it. Professor Ikegami suggests that the cost of medical devices will be driven down by competition. In the U.S., that's not true. Regulatory capture and restrictions on entries and other factors have had just the opposite effect. Professor Ikegami writes that the introduction of new technologies will also drive down prices. The United States, again, market forces are only one factor, and in fact the cost of an EHR for a large healthcare system is about several $100 million, and total implementation costs can be billions or more. He says that electronic billing will bring down prices and make them more transparent. Again, just the opposite has occurred. In sum, Professor Ikegami raises many excellent points, and he's undoubtedly extremely knowledgeable about many international systems, but his critiques based on the U.S. is missing several excellent examples that are problematic for him. In fact, the USA is moving increasingly toward accountable care organizations, which is the exact opposite of fee-for-service. So, in sum, we must thank Professor Ikegami for a forthright, honest, and valuable contribution to the literature, but I still find that there are several weaknesses in his argument. Thank you.